Hi everyone, Dr. Erika La Vella here, co-founder of Art of Bariatrics and coach of the Art of Bariatrics method. Again, what I want to do is take some time and explain how the gastric bypass can affect digestion and the chronic gastrointestinal issues that so many patients develop long-term after gastric bypass. I'll start with the caveat that I think the gastric bypass is a wonderful operation. It has a reversal rate of type 2 diabetes of 50%, meaning half of participants who have had gastric bypass that had type 2 diabetes, 50% of them long-term are now in remission and considered cured of type 2 diabetes. There is nothing else in the medical literature, not even diet and lifestyle alone, that can do this. So I am a believer in the gastric bypass. Does that mean that it's the right surgery for everyone? No. And that also means that there is a lot of fine print in sort of conditions associated with the gastric bypass. And so that's what I'm hoping this video will help shed light on, are these conditions. The big condition that I want to talk about today is SIBO. SIBO stands for small intestine bacterial overgrowth. And it's estimated that 75% of gastric bypass patients develop this condition within months after surgery. So after many, many more months, that number goes up to nearly 100%. So what is SIBO? SIBO is when the bacteria that normally grow near the colon or in the colon, the ones that help make stool, the ones that help ferment fiber. In fact, in obesity, it's believed that the bacteria themselves aren't the healthiest of species, and that's how we can get diabetes and liver disease and high cholesterol and heart disease. But once we've had weight loss surgery, that is definitely an opportunity to make this bacterial imbalance renewed and much, much, much better and healthier. So when these bacteria that normally grow near the colon start growing up in the upper part of the GI tract, you can get a lot of side effects: bloating, nausea, indigestion. Gastric bypass patients will even feel like they have reflux. And what's happening is that the bacteria that are normally forming poop in the colon, they start growing further and further up the small intestine where they don't really belong. Now, why does a gastric bypass cause this? It's largely related to the change in pH, the acid in the upper part of the GI tract. So on the picture on the left, that's normal stomach, normal intestinal anatomy. And the red dotted lines show where the intestine is cut relatively. It's a picture, so it's not the most correct, but you kind of get the gist. So the jejunum is cut in two. The stomach is create a small gastric pouch. This pouch is 2.5 inches long, 2.5 inches wide in my hands. And then the jejunum is actually cut a little further down. The picture on the right shows how everything is then rerouted and reconnected. So what happens is that the gastric pouch, this part that you eat and drink to after a gastric bypass, actually doesn't have very many acid secreting cells. Where most of the acid secreting cells are is down here in the bypass portion of the stomach. So what happens is when a person eats and drinks after a gastric bypass, normally we have acid mixing and digesting and regulating the pH of the upper GI tract, but now you don't. So bacteria that, again, normally live in more neutral conditions start growing up in this part of the bowel. And so when somebody eats something like a piece of bread, maybe a tortilla chip, a cracker, again, we can think about processed foods or not processed foods, healthy foods or unhealthy foods. In a nutshell, the more simple the carbohydrate is, maybe even like sugar, what can happen is the bacteria in there start to over ferment them. And fermentation in bacteria world means it releases gases. And in the SIBO language, the small intestinal bacterial overgrowth, it can release methane, which is like farts. So basically a gastric bypass person can eat a meal and then get so bloated and so gassy that when they're burping or when they breathe, people around them are actually smelling methane. They're smelling farty or poopy breath. Another type of species of bacteria releases a lot of hydrogen. And so you can get this kind of almost like sweet and like kind of acidic smelling breath as well. So I don't want to paint a picture of doom and gloom here, but I do want to set all of you gastric bypass people up for success long term. And in my experience, you can be really healthy after gastric bypass, but again, there's fine print, little asterisks everywhere. Number one, your food really needs to be natural. So you can still eat whole grains. I love bulgur, been eating a lot of bulgur this week, wheat berries, quinoa, um, farro, freekeh. I mean, there's literally a lot of different whole grains. And if you're curious how to incorporate whole grains into your diet, look no further. Art of Bariatrics method here, ladies and gentlemen. We are pros at this gut health stuff. So eating lots of whole grains, and again, not lots, but eating whole grains regularly. Beans, so black beans, pinto beans, chickpeas. Again, there's lots of little beans, lentils, and legumes. Again, you don't have to eat a lot, but by eating those foods, those are natural slow carbs, complex carbohydrates that takes a while for your body to digest, meaning that they'll get further downstream and make contact with the right bacteria at the right moment. So diet is really helpful, eating the right kinds of fiber, not overdoing it on soda, chips, crackers, cookies, right? Processed food that comes in boxes. That's really what we're trying to avoid. And drinking lots of water and herbal tea. Sugar is another thing that gastric bypass people have to be really mindful of, because when the bacteria start growing where they shouldn't be, yeast can also grow where they shouldn't be. And that can also contribute to a lot of these chronic inflammatory symptoms, arthritis. In fact, gastric bypass is associated with an increased incidence of autoimmune disease. And again, gut health expert here, I've read lots and lots of literature that clearly map out the link between gut bacterial imbalances and your immune system at the gut level, cross-reacting and then creating systemic inflammation. This is now scientifically proven to be the connection between thyroid issues, diabetes issues, PCOS issues, etc. So when I speak about the Art of Bariatrics method, and we are talking about weight regain and all these long chronic issues, trust me, we got your back. We know what's going on here with this gut health stuff. The other thing that gastric bypass patients can do to really help mitigate the growth of this SIBO-like process, which is nearly a guarantee if you have a gastric bypass, is to take probiotics. Now, in our methodology, we talk about prebiotics, which is the foods, the whole grains, the lentils, the beans, the fruits, vegetables, right? Nuts and seeds. The food is the prebiotic. The probiotic is the species themselves. And when it comes to gastric bypasses, the literature really supports broad spectrum probiotics, not just the ones that you get in yogurt. So many people are like, oh, I'm eating yogurt. Not all yogurts are created equal. Again, working in our coaching program, we'll be able to set you straight there with that. But also, a lot of people develop lactose intolerance after a gastric bypass because digestion is so changed. So maybe a dairy-based yogurt isn't the right thing for you. Miso is a wonderful probiotic. Sauerkraut, kimchi, wonderful probiotics. There are many cultures and traditions around the world that have fermented food practices. I'm a big fan of sourdough. I do love bread. Bread can be eaten in moderation after a gastric bypass, and you should absolutely be eating traditional sourdough because of this added benefit. The fermentation, the bacteria actually do most of the digestion of the gluten for you. You just got to be really careful with spiking and lowering of blood sugar after gastric bypass. Again, if any of this is speaking to you, contact us. Our coaching program will set you straight. So the probiotics that I recommend is something that we save for our coaching program. Just know that broad spectrum probiotics are the best, and you want many different species, bacillus species, lactobacillus species, and even Saccharomyces. I hope that you guys enjoyed that, and I hope that if it spoke to you in any shape or form about gut health, chronic abdominal pain, bloating, fart smelling, burps, etc., and you need help, I think I can help you. Join our coaching program, click the link in our bio, etc., etc. Art of Bariatrics is here for you.